The silicone implants of past, which were pulled off the market approximately 12 years ago, are a completely different product than the product that is now being used. The product that is now being used is a much better product than the product of past. Just to clarify to patients, when they pulled that product off the shelf, patients were and physicians were concerned at the time that people were having certain illnesses associated from the implant. Subsequently, when those implants were pulled off the shelf, research was done that has demonstrated that there was no cause and effect relationship between the previous implants and any illnesses. So they were considered safe. However, since that time, the current implants have been studied for 10 years, hundreds of thousands of women, and they have determined that they are a safe product. The issue was in the past is that at 10 years, approximately 50% of those implants, the outer shell of the implant had basically ruptured, dissolved, etc. But the implant material, the silicone, stayed within what we call the pocket, which is the scar tissue that surrounds the implant, and that is normal and natural. That implant material stayed there. So the woman had, her breasts felt the same and looked the same, both to the physician and to the patient, and the way to determine whether or not it had ruptured was by MRI. The new implants have been studied extensively. The FDA approved them over a year ago at this point, and they are currently still within studies with women who are getting them presently. Again, they are a different product. They're a safer product and what the manufacturers consider a better product. The pros of a silicone implant over a saline implant is that there is the probability of less rippling, which is where you see the edge of the implant. It kind of gives a little wave, which is going to be presented in someone who is thinner, has thin skin, goes with the larger implant than on a woman who's presenting already with some breast tissue and thicker skin. You're less likely to see that rippling there. But it also, as far as the saline implants have a possibility of deflation, and that is not harmful to the patient because it's just saline, but they would want to have them replaced because of the asymmetry that would exist afterwards. With the silicones, there is a possibility that they could rupture. Again, doctor or patient would not be able to tell. They would not be able to feel it. They would not be able to see it, and so they would need to get an MRI to be able to detect that. Now, with that being said, that silicone gel is now called a memory gel, and that it's sort of like a warm, soft brie cheese that if you cut it, it is going to maintain that shape. It does not go out of the capsule. It does not go into the bloodstream, so it stays there. So again, the FDA felt, after rigorous amounts of research presented to them from the two companies, Intim and Mentor, that these implants are indeed safe. So as far as safety goes, they are considered safe.